Hi there, my name is Sakshi, and in this video, I'm going to talk about what kind of breathing exercise you can do when you're pregnant, are COVID positive, and proning is not an option. Now, this is for people who have milder COVID symptoms and would like some breathing exercises to aid in their recovery. Recently, a number of pregnant people have reached out to me on Instagram saying they have been recommended proning to help with their COVID recovery, but lying on their belly is not something that feels comfortable for them, and which makes sense because if you have started developing your bump, if you're anywhere in your second or third trimester, lying down on your belly is not something that is suggested, recommended, or actually something that feels good. So what are the things how you can use breathing exercises to help with your COVID recovery? So we have to first think about how does proning help in breathing better. So first thing proning does is it helps us breathe into the back of the ribs. It creates space for the back of the ribs and helps us breathe in the back of the lungs. So more part of the lungs are accessed when you breathe in a prone position. Second thing it does is it helps us exhale a little bit more efficiently, a little bit more better. It facilitates good exhaling. So both of those things, how we can find both of those benefits in a different way, this video is going to be about that. So the first thing that we are going to do is a few rounds of cat position or cat pose or Bithilasana. This would help you create more mobility, more space in the back ribs, something that is a little bit lacking when as the bump develops, as the baby develops. So for this, you want to come onto your hands and knees, find a nice tabletop, and then we are going to find first the neutral position in which your spine is just in a neutral position, and then you're going to inhale there. As you exhale, you're going to round your spine slowly up towards the ceiling. Inhale, come back to center. Exhale, round your spine up towards the ceiling. Inhale, back to center. Exhale, round your spine up. Inhale, back to center. Exhale, round your spine up. You can continue doing that. Come back to center. You can continue with that for another few times, in total 7 to 8 times of cat poses. And then we're going to move on to our next movement, which is going to be twist. Twisting helps us create more mobility and space in the ribs. If you don't have COVID, you just have shortness of breath, which is very common during pregnancy, doing some twist, not the deep ones but the open twist, can really help in creating more space for better breathing. So we're going to come into a comfortable seated posture, however you want to sit, with your spine long. Interlace your fingers behind your head, elbows wide open. We're going to inhale in the center and exhale, turn the chest towards the right. Inhale back to center. Exhale, turn the chest towards the left. Inhale back to center. Exhaling to right. Inhaling to center and exhaling to left. Inhaling back to center. You can continue doing that for another 5 to 7 times. And then we're going to move on to the breathing practice that we're going to do in place of proning. So instead of lying down on your belly, I would ask you to come into a child pose. Coming onto your hands and knees, feet together, knees chest width or more than chest width apart, having enough space for your belly. Sit back on your heels, walk your hands forward as you can go, and soften your chest and forehead towards the floor. Make the position comfortable for you. Use pillows under your upper body if needed. Now we are going to breathe here in a way that you inhale into the back of your ribs, into your lower back, a big inhalation, and you exhale through the mouth slowly and completely. Your exhales longer than your inhales. So stay there for 7 to 10 breaths or even a couple minutes, breathing in, feeling the expansion in the back of your ribs, in the lower back, in the pelvic floor, and exhaling completely through the mouth, softening, relaxing, releasing towards the floor. These three movements done together can very well replace proning for you and help you breathe a little bit better and help in your COVID recovery. And even without COVID, these all three movements are really, really, really beneficial for you during your pregnancy. I hope this video helps you. If you find it helpful, make sure to like, leave your comments, and share it with the people who can benefit from it. I'll see you in the next video. Take care. Much love.